7.2, consideration of amendment number 1 to the agreement between the County of Lake and Vista Pacifica Enterprises Incorporated for adult residential support services and specialty mental health services in the amount of $745,000 for fiscal year 24-25. Director Jones.
Yes, thank you. I believe we are just closing out our previous fiscal year with Vista Pacifica, which is a facility that has, among other things, a skilled nursing component. So it's very valuable for individuals who might have, like, for example, dialysis needs or wound care, to have that service. And as always, we're looking to step people down into a lower and less expensive level of care. But this will help us finish up with Vista Pacifica. Thank you.
All right. Any comments from the board? Open it up for public comment. Bring it back to the board for action.
Mr. Chair, I move that we approve amendment to the agreement between the County of Lake and Vista Pacific Enterprises, Inc., increasing the fiscal year 2024-2025 contract maximum for $660,000 to $745,000 and authorize the Board of the Supervisors to sign, the Chair of the Board of Supervisors to sign the amendment.
Second.
I have a motion and a second. All in favor?
Aye.
Aye. Any
Hang on
opposed?
a second.
Is that the right number?
Which one?
It says 745. Oh, sorry. Aye.
All right. All right. So I have 5 yeses. Any noes? All right. Motion carries 5-0. There we go. Just continue down. We'll go down to 7.3. Consideration of the agreement between County of Lake and California Psychiatric Transitions Incorporated for inpatient psychiatric rehabilitation services, inpatient competency restoration services, and professional services associated with inpatient psychiatric rehabilitation in the amount of $350,000 for fiscal year 25-26. Director Jones.
Thank you, Mr. Chair. This is a really critical contract. California Psychiatric Transitions is one of the only facilities in the state of California that can serve as an alternative to Department of State Hospital. And so they're able to accept individuals who are on Murphy's conservatorship, and people who have been deemed incompetent to stand trial. So they perform competency restoration. And it's as many people as we can divert from DISH, as they call it, Department of State Hospitals, into CPT. That is good for us. So.
All right. Any comments from the board? Open it up to the public. With no public comment, I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and California Psychiatric Transitions, Inc. for inpatient psychiatric rehabilitation services, inpatient competency restoration services, and professional services associated with inpatient psychiatric rehabilitation in the amount of $350,000 for fiscal year 25-26, and authorize the chair to sign.
No second.
I have a motion and a second. All in favor?
Aye.
Aye. Any opposed? Motion carries 5-0. All right. Next is 7.4. Consideration for approval of amendment number 1 to the agreement between County of Lake and Lake County Office of Education Safe Schools Healthy Students Program for school-based specialty mental health services in the amount of $825,000 for fiscal year 24-25. Director Jones.
Thank you. Another one wrapping up the 24-25 fiscal year. To me, this marks an incredible success of the provision of specialty mental health services through the schools. I'm pleased to report a dozen, I believe, or more school sites have been certified for specialty mental health, and Lake County Office of Education runs a youth behavioral health program essentially on behalf of the county. And so I remember when I started with the department, we weren't seeing contracts above like $150,000. And so when you see a higher contract dollar amount, that's because they claim those services. That's fee for service. So that's a whole lot more youth being served in our schools.
All right. Any questions from the board? I'll open it up for public comment. No hands. Okay, so I'll bring it back to the board for action.
Mr. Chair, I move that we approve amendment number 1 to the agreement between the County of Lake and Lake County Office of Education for school-based mental health services for fiscal year 24-25, increasing the contract maximum to to $825,000 and authorize the chair to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed? That motion carries 5-0. 7.5, consideration of the agreement between County of Lake and Hilltop Recovery Services for ASAM Residential Level 3.1 and 3.5, and Intensive and Outpatient Levels of Care 1.0 and 2.1 in the amount of $2 million for fiscal year 25 and 26. Director Jones.
Thank you, Mr. Chair. I just want to acknowledge the incredible work of Hilltop Recovery. We've enjoyed a really wonderful and productive working relationship with them for many years. And now that we are a DMC ODS county, we're utilizing them more than ever because more of our beneficiaries have coverage for those services. And they have always made it a priority to take Lake County residents because they have no problem getting business. And so I really appreciate them and their dedication to our community. There's even been years past when we couldn't, beneficiaries didn't have coverage and they'd have them for free. They just did it for free. So now they're fortunately getting paid for all of this. So a critical component of our DMC ODS network.
ODS, yeah.
Yeah.
That was a really good thing when we got that waiver pushed forward. It helped with
Yes.
that. Any- Supervisor Sabatier?
I took a act of Congress. That was a difficult task. I just wanted to mention on this one, I didn't want to mention it on the previous one. This one's a bigger number item. I'm planning to approve it. Looking for consensus from the board, and I appreciate it. I send emails. I'm sure Director Jones would speak to it, always asking further questions for most of these important but also costly services. In all of the contracts, it requires an annual report to be submitted to behavioral health. I would love to see the previous year's report so we can show the public and share with us what are some of the outcomes, what are some of the demographics, because we're seeing the great intention, but we're not seeing what's the result of those great intentions. And I'd love to see if we can marry those two things together to be better exposed to that information and share more how it is that we're doing things. And I know we're working towards those things, but just looking for board consensus that would be really great if we can get, we're not going to get this year's, but if we can even get the previous years to get an understanding on the results of the actions of these contracts.
Do you have that report available because we have to have these contracts approved at this time of year. We can't wait for a report. So I'm asking, is that even going to be available?
Yes, actually, I did provide, Hilltop did provide a report. And I'd also like to further clarify that as with all other, most other contracts, there's extensive oversight by the Department of Healthcare Services. There's an incredible audit burden for these services. And so I would be cautious about imposing additional reporting requirements on the plan because we are already heavily reporting to the Department of Healthcare Services. Also, due to behavioral health transformation, the entire state is moving along in implementing outcome data tracking, but we are certainly not alone in the struggles that present themselves with those type of metrics. I think that's all my comments.
Yeah. I think the most important thing is we get these contracts approved. And I would like to see them be on consent because, I really respect your time and your staff's time. And I think, it's more appropriate for us to put these on consent and be able to approve these quickly and not have you sit here all day, even though we love you so much.
Yeah. Supervisor.
If I may
Sabatier?
respond, I'm not asking for any extra reports. Like I said, inside the contracts, there's already a reporting requirement. I get it that in August or July, having a report from the previous year is not, I'm talking about the previous year, because these contracts, the majority of them are not brand new. If they are brand new, there'll be no report to attach, but in the future there would be. And I just think it helps to be more transparent with the public. We have $19 million that we're talking about today, specifically for behavioral health. Sharing some of that information, I think, enlightens and lightens the potential conflict or issues of people concerned about the cost of these services.
Supervisor Pyska?
I mean, I think we've got the monthly newsletter. I think there's ways to share out that, we don't have to. What I'm concerned about is the amount of time that our board is spending with this. And I would like to see these put more efficiently on on consent. And so if there's a certain report you're looking for, maybe it could be added to the memo on consent, or maybe this data could be added to the newsletters that are just so lovely that your staff puts out, so that we're not putting more of a burden on staff right now.
I just wasn't clear. Is that some kind of report you already have from the previous year that
Yes,
is already something
Yes.
that wouldn't cause extra work?
it shouldn't. Although our enforcement of collecting those reports, given, as I said, the extensive auditing burden that they already experience, hasn't always been consistent. But Lori did a really good job with the one she developed, which includes not just like, what they did in the community events and things like that, which is also really powerful. But demographics, particularly when you're looking at penetration rates into different populations, you're looking for disparities. We actually also do report globally on that with our external quality review reports, which I come every year before the board, and that gives a global picture of the entire plan's work. And so now that we are a DMC ODS county, that EQRO encompasses all of those SED services as well. So there'll be really great data this next time on penetration rates, because now it's in that same system, if that makes any sense.
So it encompasses what's being asked for here?
It doesn't encompass specific provider by provider, but it breaks out all the different types of levels of care and outcomes across all those levels of care in aggregate.
Okay.
I'm good with that.
Any other comments or? No? Any public comment on this? I'll open it up. All right. We are on yes, we're on Hilltop right now. 7.5.
Nancy Ruzicka. For a number of years, I chaired the Alcohol and Drug Advisory Committee, so I was very close to the programs, and I'm pleased to see all these programs by professionals that hopefully have a good track record. Hilltop Recovery Services was burned out, was up on Common and now in Clear Lake Oaks. And we had a couple employees over the years that needed to use their services, and it was very successful. I'd like to always see where these things are located. Hilltop Recovery is local. Thank you.
Thank you. Anybody on Zoom? I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and Hilltop Recovery Services for ASAM residential level 3.1 and 3.5 and intensive and outpatient levels of care 1.0 and 2.1 in the amount of $2 million for fiscal year 25-26, and authorize the chair to sign.
Second.
We have a motion and a second. All in favor?
Aye.
Any opposed? That motion carries. Let's see, so we're just going down the list, sorry. 7.6, consideration of agreement between County of Lake and New Life Health Authority, DBA, New Life LLC, for substance use disorder outpatient drug-free services, intensive outpatient treatment services, and narcotic treatment program services in an amount not to exceed $12 million for fiscal year 25-26. Director Jones.
Thank you, Mr. Chair. This is one of those required levels of care that we do not currently have in the county, but we would love to. We're working very hard to see how we can, actually, it's just the methadone component. We do have a medication-assisted program that it's at Lucerne, it's at our clinic there, it's county operated, but it's not methadone, it's everything but that pretty much. So for those folks that methadone is the best option for them, or they want to do New Life for whatever reasons, beneficiaries have choice. So we're grateful to them for being able to provide those services. And this is also a unique contract because New Life Clinic, as you may recall, is a Tribal 638 clinic that bills a single encounter rate through the OMB, which I cannot remember. it's a federal department, and they set rates and things like that. And so essentially, Pinoleville Tribal Nation, who owns the clinic, has generously and continues to offer up the non-federal share of cost. And as you may recall, Medi-Cal is a pie, and one part of the pie is a local county match. The other part is state general fund. You ship those up to the feds, and then they ship your whole claim back down. So we do not have any cent of county funds that contribute towards these services at all. These are federal dollars that are drawn down on behalf of New Life.
Thank you for that. That was one of my questions. Any comments from Supervisor Sabatier?
I just wanted to say that I will not be voting for this, as I feel I do not have the financial information to feel comfortable for such a large number.
Right. Any other comments? Open it up for public comment. No hands in Zoom. I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and New Life Health Authority, DBA New Life LLC, for substance use disorder treatment services for fiscal year 25-26 in an amount not to exceed $12 million, and authorize the chair to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed?
Nay.
Motion carries 4-1. Next, we have 7.7, consideration of agreement between County of Lake and Willow Glen Care Center for adult residential support services and specialty mental health services in an amount not to exceed $500,000 for fiscal year 25 and 26. Director Jones.
Thank you, Mr. Chair. Again, a critical need for us. Willow Glen is a placement for many individuals on conservatorship who require a lot of help. And we work incredibly diligently to step those individuals down. We actually recently expanded our discharge planning team by, maybe we doubled it, because we're going out to these facilities, we're visiting with our beneficiaries, we're working with those programs to help figure out how they're going to step back down into the community. We have also just recently issued a notice of award to an agency through an RFP process to open up another boarding care facility. That's one of our biggest barriers, is there aren't sufficient boarding cares to step people down into. But it is big on our mind. It's not only expensive monetarily, but also it's, expensive for that individual to be out of their home for so long. So we're motivated to get them out. But nonetheless, these are pretty critical services.
All right. Any questions from the board? Open it up for public comment. Not seeing any hands in Zoom, I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and Willow Glen Care Center for specialized mental health services for fiscal year 25-26 in an amount not to exceed $500,000, and authorize the board chair to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? Motion carries 5-0. Right. Next, we have 7.8. Consideration of agreement between County of Lake and Women's Recovery Services, ASAM Level 3.1, residential treatment services to continue vital SUD treatment services for Lake County residents in the not-to-exceed amount of $300,000 for fiscal year 25 and 26. Director Jones.
Thank you again, Mr. Chair. So this is a perinatal program, which means pregnant or parenting women or people. And we do have an in-county option that is run by Roebuck Community Services called the Thule House. However, they're in a regional model, so they don't just take people from Lake, they take people from all over. Usually they're incredibly accommodating and will accept our Lake County people. However, in the event that they don't have the ability to, we have another place. And also sometimes for clinical reasons, it is better for the individual to be out of county and kind of away from the environment. And I visited the campus. It's absolutely gorgeous. They have a beautiful facility. They have childcare on site. Every time I go there, I'm incredibly impressed and grateful for the work that they do.
All right. Any questions from the board? I'll open it up for public comment. I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between County of Lake and Women's Recovery Services, ASAM Level 3.1 residential treatment services to continue vital SUD treatment services for Lake County residents in the not-to-exceed amount of $300,000 for fiscal year 25-26, and authorize the chair to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed? That motion carries. All right. 7.9, consideration of the agreement between County of Lake and Archway Recovery Services Incorporated for ASAM levels 3.1, 3.2, 3.3, 3.5, and withdrawal management levels 1 and 2 for in the amount of $500,000 for fiscal year 25-26. Director Jones.
Thank you again. This is such a beautiful result of our DMC ODS opt-in. We did not have this service available to us prior. There aren't sufficient, actually no in-county detox facilities, and so we have to go out of county, although we're working currently on building local capacity. We've visited the Archway campuses, and it's been a desperate need, so detox saves lives, and I'm grateful that we can offer this benefit to our community.
All right. Any questions from the board? I'll open it up for the public. No hands in Zoom. We'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and Archway Recovery Services, Inc. for an amount not to exceed $500,000 for fiscal year 25-26 and authorize the chair of the board to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Any opposed? Motion carries. 7.10, consideration of the agreement between County of Lake and Redwood Quality Management Company Incorporated in the amount of $1,212,019.90 for fiscal year 25 through 29. Director Jones.
Thank you. This is a pretty incredible, in my opinion, project. So this is leveraging the county's opioid settlement funds as part of the cash match for the bond grant that they were awarded. Folks are familiar with Proposition 1, and it was a two-parter, one of which was the bond. So our QMC wrote for the grant, was awarded, and with that, we'll be establishing a behavioral health campus on the property, kind of behind Burger King, like up on Hamburger Hill, I think behind Taco Bell, really. And this will be a mental health rehabilitation center with co-occurring, we can support detox, and we'll be pursuing ASAM 3.7 designation really hard. And it's also a continuum model, so there will be outpatient programming there as well to help people transition between levels of care. And I know we have somebody here from our QMC who can speak more to that if they wish, but I think it's an incredible leveraging of the county's opioid settlement funds to bring a much needed service into our community.
All right. Any questions from the board? Supervisor Sabatier?
So I'm taking a similar position for the opioid settlement funds being used without understanding or seeing the breakdown of the total amount that we're supposed to receive. I did this in a previous agenda when there was opioid settlement funds. And I'm also concerned about the process in which the plan is great. The plan is great, but we got to do it the correct way. The fact that on December 3rd, 2024, when we were provided the final plan from the community, shows that there is a plan to work with Anchor Health Management and Redwood Community Services with an opioid settlement fund match request of $1.125 million. Tells me there's some preordained RFP results. This is our RFP, and the result is the exact same that was told to us back in December. And I'm worried that not following the right RFP process of being equal to all opportunities is a potential pushback. I also have many more questions. Who owns the facility at the end? Things like that. But at this moment in time, I will be saying no on this one.
You have any?
No.
No? Any other comments from the board? I'll open it up to the public. Sir, come on up.
Good afternoon, Chairman Crandall, Board, ACO, Parker. Thank you for the opportunity to come and say hello. I wanted to introduce Redwood Quality Management Company. I'm Dan Anderson, the Chief Operations Officer for our QMC. Excuse me. We are a local company based out of Ukiah. We've been providing mental health services over there for quite a long time. We actually were the administrative service organization for, for the Mendocino County Behavioral Health Department, overseeing the delivery of specialty mental health services, managing the quality assurance and the contracts for the providers. We've also been the psychiatric services provider for beneficiaries that get services through the local mental health plan. About 5 years ago, I guess it was, we recognized there was a gap in services in the continuum of care within Mendocino County, that folks that needed a post-acute crisis inpatient hospitalization stay, where they needed some sort of transitional level of care, there wasn't anything available in Mendocino County. Folks that needed that, who were placed on a conservatorship, LPS conservatorship, or needed that chance for stabilization, recovery, they all had to be placed out of county, sometimes hundreds of miles away. And so it made it really tough to have them stay connected to their local support system, their families, and then that transitioning back home was hard because you couldn't maintain services, setting up the right housing arrangement, supporting all their needs was really hard. So we applied for a grant and actually got a BCHIP grant, Behavioral Health Consortium Infrastructure Program grant, and are almost complete with that project in Ukiah. We should be opening here in the next few weeks, 16-bed residential services. In looking at additional needs, we had extended conversations with Lake County Behavioral Health Services, some of our other partners, and saw the same need in Lake County. So we went ahead and applied for a second grant through the bond round one and got a grant approval for building a mental health rehabilitation center, outpatient clinic, and supportive services here in Lake County. And so we've proceeded ahead with that. We've submitted actually a use permit application to the city of Lakeport. As Director Jones said, the property that we have secured is in Lakeport, and so we're moving forward on that. The BCHIP grant, as Dr. Jones identified, requires a local match, and if we're co-applicants with either a nonprofit or a government agency, that can be 10%. So that's where the opioid settlement funds come in, that they can function as a local match, and helps. It wouldn't be possible without that. So it's fantastic that that's available. And we're very excited about what this will bring to Lake County and to our residents here. So we are actually joint applicants with Redwood Community Services, and the county is working with us on this too. To your question, who owns the property? RQMC, Redwood Quality Management Company, is the owner of the property, and we are working with local contractors, materials, various organizations. So this actually is not only are the services coming in, but this project is also bringing jobs, and the whole construction part of it is all supported locally. So I'm glad to be here today to share this, and look forward to making this project happen. Happy to see questions. Thank you very much.
Thank you. Go ahead, Vice Chair.
Yes, I have a question, Mr. Chair. It regards where is this at in the project with the local jurisdiction, where it's going to be located? You have an application in with the city. Is that in the review process, or
Yeah, so
trying to get an idea of what the anticipated finalization of that approval would be?
Yes. So we have property in escrow. We haven't closed on it. That's part of what the opioid settlement funds will do, is assist with the acquisition. It's about 3.5 acres there behind Taco Bell. And it's zoned C2. We've met with the planning department of the city of Lakeport, and with all the directors, it's per their opinion, it's an ideal location for this kind of a facility in terms of public access. It's not in the middle of a housing, kind of development. Utilities are accessible and so forth. So it will be built in the city of Lakeport, but the service, target population is the whole county of Lake County. So the building department there of Lakeport will be over, the building permits and the building of it. Our use permit is through the city of Lakeport. That we have submitted it. We've got the letter back from the things that we need. We do have to follow CEQA, so we'll need a bio survey, a cultural survey. We've done a hazards assessment, biohazard assessment, but it's in the process. There's a site plan, floor plans, elevations, what were submitted. We can make that available to the board too, if you're interested.
Well, you answered my question, which was what was the initial feedback from the city about the project?
Yes.
So,
Yeah, their feedback this is ideal in terms of the impact on neighbors, the community, and so forth. And the development is basically an empty lot right now for
Okay.
2 parcels. Yeah.
thank you.
Supervisor Sabatier?
Just a question for the board, since you know where I stand on this. I don't see let's say the project defaults. There's nothing about that we get the land, since we may have helped out to get the land. There's nothing about repayment. I'm not seeing a off-ramp of safety for the money being provided here, unless that can be called out and let me know where that is. But I don't see again, this is for a specific project. If the project doesn't occur, I see that whatever money has not been used is given back to us, but nothing about repayment or collateral or anything like that.
Go ahead.
Do you want me to answer that or
Yes.
respond to that?
Yes.
So the state I don't know if you've read or looked into the BCHIP grant process, the bond grant process. So it's pretty mind-numbing.
And I'm talking specifically about the $1 million from our opioid settlement.
Understood. So, but the overlay in our contract with the state is that the state actually takes the property if we don't perform, and that then they, work on meeting the service requirements that are part of the grant application. I don't have an answer in terms of the opioid settlement dollars specifically. I'm assuming that would be part of that conversation with the state. The state actually, through the BCHIP, encumbers the property and requires us to provide 30 years of services there to meet the grant requirements. The opioid settlement sort of piggybacks on the state's obligations and requirements. But maybe county council can speak to that.
You said a 30-year requirement.
It's a 30-year obligation, yes. I'll be long gone by then, I'm assuming.
Thank you.
But the programs won't.
Go ahead. Lloyd?
Thank you, Mr. Chair. So at least in part, Section 4, if we're talking about the proposed agreement that's up for your board's review and approval consideration, Section 4, the termination clause, it does speak to upon termination, a contractor shall be paid just a prorated amount of services provided up to the date of termination. So there's a proration clause there to reflect the payment for the services actually provided. I know it doesn't really speak to the real property issue component, not necessarily, but you have that built in the contract. And then on, I think on the last page of the actual contract, not the signature document, but on page 9 of Exhibit C, the compliance provisions, you also have termination for cause, in which states if RQMC fails to comply with any of the terms of the agreement, including failure to meet the required performance standards, LCBHS may terminate the contract for cause subject to the terms and conditions of the termination clause. In the event of termination, RQMC shall return any unspent OSF funds to LCBHS and shall provide all requested reports, data, and records and related services provided under the agreement. So it is in keeping with the proration clause of Section 4, and that's what I've found so far, at least in part addressing the question of funds or the return of funds.
Can I make one more comment? So there
Briefly, yes.
was a question about the RFP for the opioid settlement funds. So we had submitted an application, and I don't remember the exact date, but it was,
Late December?
yeah, somewhere. Anyways, last year, and then there was, and I don't know the internal what happened internally here in Lake County, but that was withdrawn, and we had to reapply with a new RFP notification that went out along with any other applications, and they were reviewed by the Opioid Settlement Fund Committee. As far as I know, it was we had no special treatment because we were, had already been in discussions about it. It started from scratch, as far as I know, and we had to make a complete new RFP application. We were very grateful that the committee found our application to be appropriate to fund, and without it, this project wouldn't happen. So, as far as I know, it was a competitive, fair, and above board process.
Thank you. I'm going to go ahead. If there's not any other public comment, I'm going to close.
Thank you
it.
very much.
Thank you. And I'll bring it back to the board for action.
Mr. Chair, I move that we approve the agreement between the County of Lake and Redwood Quality Management Company, Inc. in the amount of $1,212,019.90 for fiscal year 25 through 29 and authorize the chair to sign.
Second.
I have a motion and a second. All in favor?
Aye.
Aye. Any opposed?
Nay.
Motion carries 4-1. Next, we have 7.11. Consideration of agreement between County of Lake and Sierra Pathways, a licensed social worker corporation for in the amount of $960,281.57 for fiscal years 25 through 27. Director Jones.
Yes, Mr. Chair, I apologize, but we must move this to a future agenda date. It needs edits.
All right, that looks, so we'll push that to a date to be determined. Open it up for the public just in case someone wanted to speak on this. No hands in Zoom. Bring it back to the board and close that item. Is there anything else we have that's yours on here?
Am I done?
I don't think so. I think 7-11 was the last one, right? All right.
I want to thank you, Director Jones. This is just each year we're able to serve more and more people, and this is just fundamentally changing our communities and uplifting our people, and it's your hard work and your team's hard work, so thank you so much.